So this is a 20-year-old male patient presented with the dribbling of saliva, deviation of angle of mouth towards left side, complaint of left-sided weakness. Why I have written it twice? And known case of Down syndrome. So we have two things. One is weakness, one is Down syndrome, another is just 20 years of age. What are the things we need to look at? Now let us look at diffusion weighted images as always first. And you can see there is a diffusion restriction going on the left side. Here they said the weakness is towards the left side. So kind of difficult to know that why there should be a weakness towards the left side when actually the finding is also towards the left side. So that's one thing we're not able to correlate here, but that's fine. We'll look at another images just to be sure about it. Okay, on the flare there is some signal there. On T2 weighted images again there is some signal, hyperintensity. T1 weighted images, it's a bit hypo. On SWI image, well, there is a mild, I might say, some sort of blooming, not really. Why they have done this, I have no idea, but you can look at some aspects here. One, after ICA bifurcates, look at the MCA. Looks a bit beaded, a bit narrowed on the left side compared to the right side. Look at that, there is no flow void there. Now go back and see T2. Looks narrowed here too, right? Yeah, so what do we need? Look, let us look at the coronal image. Well, unfortunately, doesn't give much idea, does it? Let us look at the top images now. Now, as you go up, you see, you don't see actually left MCA, do you? So there is a possibility that there is a thrombosis there, and maybe there will be a formation of moya moya with time. And point I was showing you the Down syndrome and a stroke is it's not really uh, a coincidence that in 20 year of age the person got it, the stroke. That's not really the case because Down syndrome itself predisposes to stroke. So why the predisposition? What are the risk factors in Down syndrome which makes person more likely to get stroke? So these are the four things. One is heart disease, another one is a moya moya disease, which I talked with you the possibility of it, then hypercoagulation and Alzheimer's because of the buildup of plaques. Um, Mostly in children you will have this. Right. So that's it. Just wanted you to be aware that in Down syndrome there will be possibility of stroke, and you need to do angiography in those cases just to see whether there is some underlying pathology like moya or other thing you can, you know, uh, look for. So why there was the left side weakness? To be frank, I don't know. Kind of tried to take a feedback, thinking maybe that's actually error. So I'm just waiting to hear back. So whether it's really a typing error, but the weakness from this small infarct, I don't think it will be that dense, because had it been in the internal capsule, it would have been more denser. It's more superficial, and compared to the blockage here, the infarct is not that big. That makes me wonder there will be a lot of collateral collateral circulation going on. Look at the SWI images again. On the right side you can see really the MCA nicely, but not the case on the other side. And now look at these arteries. These are prominent compared to the right side on the left side, so possibly these are the ones which are feeding brain on the left side because of the collateral circulation, so to speak. If the thrombus, I guess. So I just went back and saw the clinical notes. There was no mention of the weakness. There was only mention of deviation of mouth towards the left side. The infarct was on the right side region, right? So the face is represented somewhere around parietal lobe. So that was our region predominantly. It was bit up, and it is for both, like somatosensory and cortical, maybe possibly both. So if this is the area which is responsible for face, which is supposed to move the face towards the, you know, right side, because this will area to be representing for the right side. Now when those muscles will not act, the face will move towards left side, because the left sided muscle will have no one to balance, and that's why deviation of mouth will be towards the ipsilateral side of stroke. There was no mention of weakness, so that really solves it. I guess sensory information should have been put. So in this case, the sensory information would be possibly there is loss of sensation near the face, maybe nose, maybe to eye. So corneal reflex and all should have been checked, and maybe for face and lips as well, somewhere around here. Cool. Interesting field, neurology and neuroradiology.